In this video, we shall demonstrate the procedure of insertion of the nasogastric tube and the method of intragastric tube feeding. Intragastric tube feeding is indicated in stable, low birth weight babies who are not able to accept breastfeeding by palladai or katori spoon. For intragastric tube feeding, you would require feeding tubes, syringes to measure the correct amount of milk, a stethoscope, measuring tape and scissors. Two different sizes of feeding tubes are required for feeding newborn babies. Size 6 French is used for infants weighing more than 2000 grams, while size 5 French is used for babies weighing less than 2000 grams. Before inserting the gastric tube, first wash your hands. Then estimate the length of insertion by measuring the distance from the tip of the nose to the earlobe and then onto the infant's abdomen just below the rib margin. Note the reading on the orogastric tube. There is no need to routinely lubricate the tube. Flex the infant's neck slightly. Pass the tube gently through the mouth. Once the required length is inserted, fix the tube with the adhesive tape. To check the position of the tube, take air in a 2 ml syringe. Place the stethoscope over the abdomen. Now, quickly push the air down the tube and listen for the sound. The second option is to check the position of the tube by aspirating the contents of the stomach and to see if it looks like curdled milk. After you have confirmed the position of the nasogastric tube, start giving feeds through the tube. Measure the required amount of milk using a clean syringe. Remove the plunger of the syringe. Connect the barrel of the syringe to the end of the gastric tube. Pinch the tube and then fill the barrel with the required volume of milk. Hold the syringe above the infant. Release the pinch and let the milk flow through the gastric tube by gravity. Do not force milk through the gastric tube by using the plunger of the syringe. Cap the end of the gastric tube after giving feeds. Store the syringe in a clean and dry container for next use. The syringe should be changed in every shift. Thank you.